Discuss about heart, and the information which I am going to give you is very vital, and I think you should share that with all those family members who are above 40. See, any muscle which contracts again and again, it increases in size. So person who has to develop his biceps, he goes to the gym and does this, and the biceps increases in size. Heart is also a muscle which keeps on contracting. Now what is happening is, heart also increases in size as the age progresses because of the constant contraction. That size may not be too big, slight. But that slight increase in size is not accompanied by increase in perfusion. And that is why we see heart attacks at age of 40, 45. So how people can avoid that? So to increase the perfusion of the heart, one has to do something by which the heart contracts, the heart rate goes beyond 100. Like climbing the stairs. Okay, now running, I would again say running protects your heart, destroys your knees. So anything in which you are jumping at a young age, that would still fine. As age progresses, not advisable. At least the shoes are good, the ground is shock absorbing. Like when you run on a seashore, the leg goes in, that means that is the pressure we are putting, so that is safe. Yeah, doing that same in the water is still good. Anything that increases the heart rate will increase the perfusion. So use steps. Staircase, you have seen me always using the staircase. For me, my house is on the 14th floor. I use the staircase. My friend sometimes says I am on the 20th floor. I get excited, I use the staircase. Now you may say, sir, we also run for the local at Virar station, and then that is exertion. There is difference between exertion and exercise. Exertion damages you. Exercise has to be done in a relaxed way. Okay, so जो सुबह अगर आप बोल रहे हो कि 8:15 के लेक्चर को सर हो गया ना सर परफ्यूजन, no. With that anxiety, it is more of fight and flight type of reaction where more epinephrine, non-epinephrine is secreted. That is not exercise. You come here at 7:30 and climb, then that is exercise. You come at 7:59 and then you run for attendance, that is exertion. So tell this to your parents, to your uncles, anybody, that you need to do something by which you become breathless in a relaxed atmosphere. That will increase the perfusion of the heart, and heart attacks can be avoided. Thank you. Heart, pause kar. So now we are discussing the heart, and last time I had told you that heart is not like this, right? It is not like this, but a combination of this, and this is how the heart, the combination looks like. The heart is like this. Okay, and this horizontal sulcus which separates the atria from the ventricles actually goes like this. Actually goes like this. This vertical sulcus separating the two atria goes like this. So ये जो डॉटेड निकाल रहा हूँ वो पीछे के साइड का. Heart has a base. Now this is not the base है, ये superior border है. इसके behind ऐसे base है, ये apex है. Heart has 4 surfaces, 4 borders. Superior border, the right border, inferior border, left border. Apex of the heart is formed by the left ventricle. So this is right ventricle, this is left ventricle. This is right atrium. Left atrium is behind. Left atrium is behind. You cannot see the left atrium in this view. Base of the heart is formed by the left atrium and right atrium. कोई पुस्तक उघडलंय का? Krishan, base of the heart is formed by left atrium and also partly by the right atrium. बरोबर? Superior border दिख रहा है आपको वहां पे, is formed by the right atrium, slightly by the left atrium. Okay? चलो अभी बताओ. राइट बॉर्डर इज फॉर्म बाय राइट एट्रियम. इंफीरियर बॉर्डर इज फॉर्म बाय
राइट वेंट्रिकल.
राइट वेंट्रिकल प्लस राइट वेंट्रिकल है ना, एंड लेफ्ट वेंट्रिकल. लेफ्ट बॉर्डर इज फॉर्म बाय लेफ्ट वेंट्रिकल प्लस लेफ्ट एट्रियम. थोड़ा सा इधर लेफ्ट एट्रियम आ जाता है, उसका ऑरिकल आता है यहाँ पे, लेफ्ट ऑरिकल. ओके. एंटीरियर सरफेस इज फॉर्म्ड बाय राइट एट्रियम प्लस राइट वेंट्रिकल प्लस लेफ्ट वेंट्रिकल मेनली. कृष्ण इज चेकिंग एंटीरियर सरफेस. उसमें लेफ्ट एट्रियम नहीं लिखा है मोस्टली तो. ओके, ठीक है ठीक है, मैं तुमको टाइम देता हूँ. देन देर इज राइट सरफेस विच इज फॉर्म बाय द राइट एट्रियम, मेनली बाय द राइट एट्रियम. राइट सरफेस. ओके. इंफीरियर सरफेस. अभी इंफीरियर सरफेस क्या है यहाँ से आगे, तो एक्चुअली वो इंफीरियर सरफेस इज ऑल्सो कॉल्ड एज डायफ्रामेटिक सरफेस. डायफ्रामेटिक सरफेस. दैट डायफ्रामेटिक सरफेस इज ऑल्सो, दिस इज ऑल्सो कॉल्ड एज डायफ्रामेटिक सरफेस बिकॉज उसी पे उसको हाथ में लेते हैं हम लोग. इट टचेस योर पाम व्हेन यू होल्ड द हार्ट इन एनाटॉमिकल पोजीशन. ओके. सो टुडे you are going to touch somebody's heart. Okay, and tomorrow the next dissection you are going to break somebody's heart to see the interior of the heart. Inferior surface is mainly formed by the left ventricle and also by the right ventricle, mainly by the. तो ये जो बॉर्डर आपको दिख रहा है ना, ऐसा जा रहा है, ये एक्चुअली इंफीरियर सरफेस पे होता है. And the left surface is formed by the left ventricle and left atrium. Krishan, can you confirm about the anterior surface? इतना टाइम नहीं मेरे पास. एट्रियम जो है ना, एकदम जैसा मैंने देखा ना, इतना सा रहता है वो, बट स्टिल यू हैव टू इंक्लूड इट. हाँ,
1, 2, 3 stand.
So we are discussing the exterior of the heart again. The heart has an apex here, a base. This is the coronary sulcus which separates atria and ventricle. This sulcus is called coronary sulcus. And this is interventricular sulcus which separate the two ventricles. This is right atrium, right ventricle, left atrium is on the other side. Now heart has 4 borders, 4 surfaces. Base is formed by right atrium and left atrium. Apex is formed by the left ventricle. Superior border is formed by the right atrium, slightly by the left atrium. Right border is formed by right atrium. Inferior border is formed by right ventricle and left ventricle. Left border is formed by left ventricle and left atrium. Four surfaces. Anterior surface, all four are there. Mainly right atrium, right ventricle, and left ventricle thoda sa, and left atrium very little bit. Right surface is formed by the right atrium. Inferior surface is mainly formed by the left ventricle. ये ऐसा नीचे चला जाता है, and also by the right ventricle. Left surface is formed by left ventricle and slightly by the left atrium. So these are apex, base, anterior surface, right surface, left surface,
Inferior.
and
Inferior.
inferior surface, which is also called as diaphragmatic surface. Thank you. So the aorta has three valves, the aortic valves. What is the purpose of these three valves? It start ascending aorta I'm talking about. So that when the blood is pushed into it, these three valves close. Okay? So that when the heart relaxes, the blood should not flow from aorta back to the which ventricle? Left ventricle. So these valves become full in diastole. In these valves, there is the origin of coronary artery. So there is anterior sinus, aortic sinus. There is left posterior. There is right posterior. Right posterior is called as a non-coronary sinus. Non-coronary sinus. While left posterior gives origin to the left coronary. This origin to right coronary. Non-coronary sinus. मतलब उसमें साइनस है, but there is no coronary artery coming from there. दो ही coronary है. There are three valves in the root of the ascending aorta. One anterior, left posterior, right posterior. तो ये वाल्व देखो, ये वाल्व ऐसे है suppose. So blood जब left ventricle push करता है तो ये ऐसे हो जाते हैं. Then when it relaxes, ये ऐसे होते हैं. So they catch all the blood which comes back, okay, which regurgitates kind of. Or then what God has done is here when there are origins of coronary.
1, 2, 3, start.
So we had one very, very legendary teacher, Manubhai Kothare. Still you go to KM hospital, there is a MLK chair for humanities. MLK, we used to call him. Look, MLK sir. And he used to teach us philosophy through anatomy. And I was so fortunate to learn from him at KM. One thing he used to tell when he used to teach about heart, he said, learn from heart, Yuvraj. It contracts, pushes the blood so that blood reaches all part of the body in systole. And then when it relaxes, whatever blood comes back, heart accepts it. So heart accepts the blood only in diastole, the blood which has come back to it. जो भी थोड़ा बहुत बचता है, what it comes back to it. So in diastole the heart also is relaxed. So that is the time when the blood moves through the coronaries very properly. Otherwise also it is there. So he said, learn from it. We should always give. First priority of the heart is to provide blood to the whole body. So we should be giving to others. And whatever remains, he said, we can accept for ourselves. There are 4 va in Marathi as regards money is concerned. Va, vatsva, paise vatsva, bachao, paise bachao. Then va, vadva. From the money what you have, Try to invest it, increase it. Then Vapra. Vapra, you use the money for the right cause. And last, Vata. Now that is so difficult. Vata means to distribute to those who are in need. Vatsva, Vadva, Vapra, and Vata. So be like a heart, give it to others, and whatever remains will always come back to you. So now going to the coronary circulation. So I have drawn the aorta here, okay? And what I have taught you. The three sinuses, three aortic sinuses, okay? I have
1, 2, 3, start.
I have already told you that I already told you that the right coronary takes origin from the anterior aortic sinus. Left coronary takes origin from left posterior. What about the right posterior? We call it non-coronary sinus. This right posterior sinus is projects in the right atrium. It's a huge sinus. It projects in the right atrium, and that is called as torus aorticus. Torus aorticus. So that is there in the uppermost part of the interatrial septum. We need to remember this. So sometimes during some procedures, it's very easy to enter right atrium, right? Enter through any of these veins, superior vena cava, right atrium. So access the left atrium, anything operating in the left atrium, it's easy for us to go via right atrium. So that time they pierce the interatrial septum. That time one has to remember there is torus aorticus in the upper part. And if we pierce there, pierce the aorta. See, आर्टरी कट होता है, मैंने बोला ब्लड फाउंटेन जैसे आता है, एओर्टा को पियर्स किया तो खत्म, ओवर द एंड, उधर ही पेशेंट इतना ही करेगा वो, ज्यादा इससे ज्यादा एक्सप्रेशन देगा. So therefore knowing anatomy of torus aorticus is very important. एंड ये टॉरस एओर्टिकस आप बोले सर क्या बता रहे हैं, बड़ा बड़ा चीज. एमबीबीएस के फर्स्ट एमबीबीएस एग्जाम में ये आया था, टॉरस एओर्टिकस. आई जॉइंड एनाटॉमी एंड दैट टाइम वी हैड मुंबई यूनिवर्सिटी एंड देन immediately that was the last batch I taught and immediately MBBS चालू हो गया. उसमें फर्स्ट यूनिवर्सिटी पेपर ऐसे एक एक क्वेश्चन आया था, बिकॉज चेंज हो गया ना. पहले मुंबई यूनिवर्सिटी था, उसका पैटर्न अलग था. MBBS वैलेनबर्ग सिंड्रोम. व्हाट इज वैलेनबर्ग सिंड्रोम? हाँ, ये सन्नाटा क्यों है मेरे भाई? ये किसका डायलॉग? ये सन्नाटा क्यों है मेरे भाई? क्या हो? हाँ, ये डायलॉग किसका? ये तो बोलो. शोले. शोले कौन बोला? शोले हाथ ऊपर करो. हाँ, थैंक यू. बोलो. ओके, सो लैटरल मेडुलरी सिंड्रोम याद आ गया आपको? ये लड़की किधर गई इधर? हाँ, लैटरल मेडुलरी सिंड्रोम यूनिवर्सिटी क्वेश्चन. थोड़ा चेंज ऑफ टॉपिक इन बिटवीन सडनली. तुला ते त्रास होतो का पकडायला? हां जस्ट चाल, तुझ्यासाठी तर मी आणलंय की तुझा अभ्यास डिस्टर्ब होऊन तू थर्ड बेंचवर जाऊ नयेस म्हणून. ठीक.
1, 2, 3 start.
So this is the medulla. If you remember, mid-olivary section. This is the posterior part. In the posterior part, we have the hypoglossal triangle, we have the vagal triangle, right? And then there is vestibular nuclei. Anteriorly, there are pyramids. Medially, then there is olive. Wow, क्या बात है! I'm so happy. Inferior olivary nucleus. Medial medullary syndrome happens. 3 structures are affected. 1, 2, and 3. Medial medullary syndrome. When the medullary branches of the vertebral artery are affected, medullary branches. 3 structures affected. 1, hypoglossal nerve. 2, medial lemniscus. 3, pyramids. So there will be hemiplegia. There will be anesthesia on the opposite side, hemiplegia on the opposite side, right? And tongue on the same side. Okay? So this side is affected, the tongue of this side, opposite side anesthesia and opposite side paralysis. Lateral medullary syndrome. What is the artery? Bolo, Saloni. Pica. Posterior, inferior cerebellar artery. What are affected? 1, nucleus ambiguous. So there will be dysarthria. There will be dysphagia because that is supplying the muscles of pharynx, muscles of the larynx. Okay? Then what happens? There is spinal lemniscus over here. So pain and temperature of the opposite side is gone. Then there are descending sympathetic fibers. So this leads to anhydrosis and then meiosis. All the descending sympathetic fibers are affected. Okay, the taste will also be affected because there is nucleus of tractus solitarius on it. There will be slight ataxia also because there is inferior cerebellar peduncle. So this lateral medullary syndrome, medial medullary syndrome. Medial medullary is very easy, only 3 things. Lateral has a whole list of symptoms. First question in MBHS, first exam. Okay, lateral medullary syndrome, also called as Wallenberg syndrome. Wallenberg's आहे ना रे त्याचं नाव? मी आता just late. I suddenly I taught it so well. Okay. So now we are here. कैसे पहुंचे हम लोग उधर? आइका टॉरस एओर्टिकस. वो भी एक क्वेश्चन था. वो तो किसी को आया नहीं. और तभी गूगल भी नहीं था, फॉर योर इंफॉर्मेशन. तभी कंप्यूटर्स भी नहीं थे. हम लोगों को कुछ ऑप्शन ही नहीं था समझने को. बस गूगल आने के बाद हमको समझा टॉरस एओर्टिकस क्या है. बुक्स में नहीं दिया था. ओके. सो राइट coronary starts from anterior aortic sinus, enters the right anterior coronary sulcus, right anterior coronary sulcus, right posterior coronary sulcus, goes here and it gives a branch called as posterior interventricular artery. क्या नाम है इसका? Posterior interventricular artery. आप में से जो एस्पायरिंग कार्डियोलॉजिस्ट से जरा ध्यान से सुनो. ओके, नहीं सुनो नहीं, लिखो पहले. Now the left coronary will arise from left posterior aortic sinus. जैसे वो अराइज होता है, इट गिव्स अ ब्रांच कॉल्ड एज एंटीरियर इंटरवेंट्रिकुलर आर्टरी. इट गोज इन दिस sulcus, goes posteriorly and anastomosis with posterior interventricular artery, and then it continues as circumflex artery, which goes here in the and anastomosis with right coronary. Anastomosis with right coronary. ओके. आप सोच रहे कि अरे दो जगह एनास्टोमोसिस है, इधर राइट एंड लेफ्ट कोरोनरी, इधर पोस्टीरियर इंटरवेंट्रिकुलर एंड एंटीरियर इंटरवेंट्रिकुलर. तो क्या मेरे हार्ट को आप काय को मेरे को स्टेप्स चढ़ने को बोल रहे हैं? नाही. राईट कोरोनरी अँड तुझं हो देतले
1, 2, 3 start.
right coronary and left coronary, their anastomosis is like friendship, false friendship होता है ना, कुछ लोग जो हाथ मिला देते हैं हिंदी चीनी भाई भाई ऐसे बोल के वो तो है ही नहीं दोस्ती कुछ. That is how this anastomosis is. आपको लग रहा है कि right coronary is anastomosing here, anterior interventricle is anastomosing here. नहीं. This, when there is a blockage, इतना अभी कुछ हो गया चाइना में, था ना भारत में, इंडिया में कुछ हो गया, चाइना कभी आया तो मदद करने को कि हम आपको मदद कर, वैसा ही है. When the blockage is slow, अगर गॉड आपको ऑप्शन देता है कि तुमको हार्ट में ब्लॉकेज होने वाला है, कुछ ऑप्शन चाहिए इसके अलावा, लेट इट बी स्लो. व्हेन ब्लॉकेज इज स्लो, you know the collaterals they develop. When the blockage is fast and sudden, the collaterals don't develop. One is blockage. Another thing in heart is coronary spasm. ब्लॉकेज ठीक है यार, ब्लॉकेज हम लोग हैंडल कर सकते हैं, थोड़ा थोड़ा होने लगा, एक्सरसाइज कर रहे से एक्सरसाइज करते हैं तो ब्लॉकेज, एक्सरसाइज, having antioxidants, you know, all those things will clear the blockage जितना फास्ट होता है वो. What about coronary spasm? वो कभी होता है सर, स्टॉक मार्केट गिर गया सर, रिलायंस का सारा सेल वो सी, सो माइंड इफेक्ट्स. सर आपकी लड़की भाग गई वो बाजू वाले के साथ वो हमने देखा है ना, लोग ऐसे गिर जाते सीधा. पीपल यू नो दे इन आईसीयू, वो डॉक्टर आके बताते कि आई एम वेरी सॉरी, तो जो सुनता है ना उसको भी आता है. दैट इज कोरोनरी स्पाज़म. So somewhere we, even you as doctors have to step, you know, practice some amount of spirituality in your life. How to keep your mind stable, you know, not affected too much by emotions. Because affecting too much by emotions also leads to heart attack. भले आप whole life आप एकदम शुद्ध, you know, food खा रहे हो, ये कर रहे हो, exercise कर रहे हो, but what about coronary spasm? That is something related to the mind. So heart disease is not always because of bad diet. Yes, it is also because of a bad mental framework. All those things, hatred, ये जो सब है ना, all that affects the everything. Our every emotion affects the heart. अभी इसके बाद सेमिनार होगा तो उधर जो बैठे रहते हैं, रोल नंबर 31 to 60 में या 61 to 61 गया तो 65 को धड़ 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 64 बोलने का धड़ 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 धड़. Hello everybody, my name is and I am now going to present before you the symptoms of the धड़ 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 धड़. इधर emotions affect the heart, so we have to learn to be emotionally stable also if we want a healthy heart, healthy diet and also healthy emotions. Now with that I am going to talk about area supplied by the right coronary and area supplied by the left coronary. See, right coronary will supply right atrium, left coronary will supply left atrium. Right coronary will supply right ventricle, left coronary will supply left ventricle. इतना इजी नहीं है. Because left coronary gives anterior interventricular, so it will also supply the anterior-most part of the right ventricle. And right coronary, because it gives posterior interventricular artery, it will supply right ventricle and posterior most part of left ventricle. समझे आप? Everybody is with me over here? Left ventricle is giving, left coronary is giving anterior interventricle. It supplies left. So in short, the blood supply of the left ventricle will be mainly supplied by the left coronary, except the posterior most part, which will be supplied by right coronary, because posterior interventricular is given by that. Then the interventricular septum. Posterior 1/3 is by right, anterior 2/3 is by interventricular septum supplied posterior 1/3, anterior 2/3. Okay. Now the conducting system of the heart. SA node 60% of the time by right, 40% of the time by left. AV node, ये मालूम है ना, मैं ये हवे में बोल रहा हूँ. SA node, AV node 90% of the time, 10% of the time by the left coronary. Okay, and the whole of the conducting system is by right coronary, except for the left bundle branch of his is by the left coronary. Okay, applied anatomy. हाँ, 60% in 60% of cases at Nair Hospital, of all of you, of the 150 students, 85 students will be supplied by the right coronary and remaining by. Okay. Applied anatomy, two things you have to write here. One is PCTA, percutaneous transluminal angiography and plasty. Percutaneous, यहाँ से femoral artery closest radial artery, उसमें से जाओ अंदर aorta में ascending aorta, go to the sinus, go to the artery. This is how through we have to go to the artery basically. ओके, रेडियल में से जाओ कहीं से भी. ओके, CABG, कोरोनरी आर्टरी बाईपास ग्राफ्ट. सो दे टेक सेफेनस वेन. सपोज यहाँ पे ब्लॉक है तो सेफेनस वेन को लेते हैं और फिर यहाँ से यहाँ तक कनेक्ट करते हैं. CABG. ओके, तर चालू राहू दे. हाँ, मागच्या बाजूला हे.
1, 2, 3 start.
So we are discussing the coronary arteries again. Look here. The right coronary starts from the anterior aortic sinus. It goes through the coronary sulcus and goes posteriorly and gives posterior interventricular artery. The left coronary It starts from the left posterior aortic sinus. It goes in the left anterior coronary sulcus, left posterior, and before starting, it gives a branch called as anterior interventricular artery. Then it continues as circumflex artery. So the areas supplied by the right coronary versus the areas supplied by the left coronary. Right coronary supplies the right atrium, left supplies the left atrium. As regards the ventricles are concerned, right coronary supplies the right ventricle and the posterior most part of the left ventricle. The left coronary supplies the left ventricle and anterior most part of the right ventricle because it gives anterior interventricular artery. Interventricular septum, posterior 1/3 by right coronary, anterior 2/3 by left coronary. Some books say anterior half and posterior half. Krishan can confirm with us. Conducting system, the right coronary 60% of the time is supplies the SA node, while 40% of the time SA node is supplied by the left coronary. AV node 90% of the time is supplied by the right coronary. 10% of the time it is supplied by the left coronary. The whole of the conducting system of the heart is supplied by right coronary except for the left bundle branch. As regards the applied anatomy is concerned, you have to remember PCTA, percutaneous transluminal angiography and angioplasty. Through the skin we reach the radial artery, through radial artery reach the ascending aorta, and through the sinuses go to the artery and do the repair. CABG is coronary artery bypass graft. So when the block is really severe, we take the great saphenous vein or any other superficial vein and connect it at the 2 points beyond the blocks, that is CABG. Thank you.